Hello everybody, my name is Dr. Amit Kulkarni. I am a consultant neurologist attached to BGS Global Hospital. Today I am here to clear a few myths about what is a chronic condition called as epilepsy. Now what is epilepsy? Epilepsy is a tendency to have recurring seizures. In other words, seizures we call them in normal language as fits. Whenever anybody has more than one episode of seizures which are unprovoked, this is called as epilepsy. Epilepsy has been, for the time immemorial, been associated with a lot of myths. People have thought of it as chronic curse or evil spirits or some possession of some kinds, which is not true. So, as we know today, epilepsy is more of a chronic medical condition, just like diabetes or hypertension. And epilepsy can be well controlled with the currently available array of medicines. I would like to tell people who are in the villages or who are not aware of the present scientific clinical data that epilepsy is eminently treatable. Some conditions of epilepsy can be cured. However, the ones which cannot be cured can be very well controlled with medicine or with surgery or with some specialized forms of diet or with some other forms of surgical treatment. I would like to share some tips as to what we as common people need to do when somebody is having an epileptic fit right in front of us. The first thing that we need to do is we need to take him to a safety position. That is, if the person is falling down, we need to ensure that he does not fall down and hit himself and cause injuries to his head or to his body. So for the first thing that we need to do is hold him to a position of safety. We need to loosen the neckties or any tight bandages or any tight clothing that he has so that he is safe. Then what we need to do is slightly turn him to that side or to one side in that we call as a lateral position, so that whatever saliva is formed, it just dribbles out of the mouth and does not go back into the lungs. It's very important that we don't restrain the seizures when they are occurring. That means we do not hold the hands tightly or the legs tightly, because when somebody is jerking, that can lead to dire consequences. So once we take the patient to the position of comfort and ensure his safety, what we need to do is we need to give a patient listen to what is happening, and we need to call for an ambulance as soon as possible and arrange to take him to a closest or the nearby hospital where he can be medically managed. I'll briefly discuss about the various types of seizures. One of the most common seizures that we encounter in our day-to-day practice is generalized tonic-clonic seizure. What happens in a generalized tonic-clonic seizure is a person suddenly faints or falls to the ground unconscious, and which is associated with uprolling of the eyeballs. It's associated with frothing and tonic and clonic, that is jerking movements of all four limbs. The person is not aware and is deeply unconscious during this time. So this is one of the most common forms of epilepsy that we encounter. So this is also one of the most dangerous forms, because as a patient convulses, there is a chance of a lot of muscle breakdown happening in the body, which can lead to myoglobinuria and renal failure. Also, which is very important, is that whenever somebody is having generalized tonic-clonic seizure, it's important that the duration of this seizure does not exceed 5 minutes, because if the duration of seizure exceeds 5 minutes, then this is a modern definition of what we call as status epilepticus. So when somebody is having a prolonged seizure, or when somebody has a seizure and in between the patient relaxes and then again without regaining consciousness the patient throws another seizure one after the other, this is status epilepticus, and this is a life-threatening emergency. Whenever somebody has a status epilepticus, the first priority is, apart from ensuring safety of the patient, what we need to do is take the patient into an ambulance to the closest possible hospital. If drugs are available at hand, we need to give something to arrest the seizure that is happening. IV lorazepam is one of the best medicines that we can give in this circumstance. Once we reach the hospital, then it's the neurologist's perspective how he treats this form of epilepsy. There are other forms of epilepsy which don't look so dramatic, one of which is called as complex partial seizures. In these kind of epilepsies, what happens is the person may have transient loss of consciousness which may occur at the beginning or towards the end of the episode. The patient may have some automatisms, like he may have some movements of the hands, he may have some orofacial automatisms. Whenever somebody has these kind of spells, they may or may not lose balance and they may or may not fall to the ground. But it is important to recognize when somebody is having a staring spell, or when somebody looks towards one side, or when somebody is having some orofacial grimacing or automatisms, or having some limb automatisms. It is important to recognize that this is a form of seizure and seek medical attention. This is also extremely common in our day-to-day clinical practice. Apart from this, we encounter something which is very common in children, that is called as absence seizures. What happens in absence seizure is the child has a typical staring spell, may or may not have automatisms, and the child is lost for a short time. The school teacher or somebody who is observing the child may say that the child is suddenly lost. Suddenly the child does not respond to what is being spoken to the child. This is called as absence epilepsy. Now there are some rarer causes of epilepsy which are called as atonic epilepsy or atonic fits. Here what happens is there may be sudden loss of balance and the patient falls thud to the ground. There is usually associated loss of consciousness and the child or the person recovers consciousness immediately. Seizures in children may be associated with a lot of embarrassments to parents or to the child itself at the schools. It's very important to give a positive outlook to the child as well as to the parents that this is a potentially treatable disease, and most of the times the child will perform well in academics and in future life. It's very important that the child understands that he can lead a normal life without any hitches, and child can achieve full potential in life. It's also important for the parents not to actively discourage the child from playing sports. It's important to take a medical opinion as to what kind of sports this child can be allowed and as to how much of an activity in a day is allowed for this child. There are so many conditions which can be treated with medications. There are some conditions which need to be given specialized form of diet for children, what we call as ketogenic diet, and there are so many conditions which can be potentially treated by epilepsy surgery. That is where it's very important to consult a neurologist or an epilepsy specialist for the management of epilepsy in children. It's important also that women who have epilepsy or women who are of a childbearing age, they are not frightened about the dire consequences of epilepsy, and it's important that they do not fear that they will have a child with epilepsy. It is not always true. More than 90% of the women who conceive, who are epileptic, do not have any problems during delivery and almost always deliver a normal child. However, it's important to seek medical advice as to what kind of medicines are safe during pregnancy and what they need to do if there is a fit during pregnancy. It's also very important that whenever somebody, a pregnant lady, has got fits during pregnancy, it's important that she seeks medical attention at the earliest. And it's important that the fits are aborted at the earliest, because this can lead to a potentially life-threatening problem in the fetus. Women with epilepsy, there are a lot of medicines available today, and these medicines are much safer than the medicines that were available earlier. So with these medicines, the women with epilepsy do have a normal conception and do have a normal pregnancy and almost always a normal child. It's also important that periconceptionally they are prescribed folic acid, which prevents a lot of congenital problems in the child. People with epilepsy need to avoid certain triggering factors. Sometimes the triggering factors are known to them. For example, in this part of India where we stay, hot water epilepsy is very common. So these people need to avoid taking bath with hot water. Along with that, they need to avoid their triggering factors that they know, like prolonged flashes of light or lack of sleep or emotional or mental stress. So these are very important, that the persons who know that these are their stressors should avoid these things. Patients with epilepsy need to follow important diet plan. Along with that, they need to take a nutritious diet. They need to follow a regular exercise protocol. Although they should not rigorously exercise, but they need to follow some physical activity throughout the day. They should ensure that they sleep well. They should ensure that they avoid the emotional and mental stress. Along with that, they need to keep taking the medicines on time, because if the medicines are skipped or if the medicines are not taken on time, chances of they having a breakthrough seizure is very high. Epilepsy affects millions of people worldwide, and it approximately affects 1 in 100 people. So the patients of epilepsy should realize that they are not alone in this battle against epilepsy. We are all with them, and we will all fight against epilepsy towards a common cause. We should ensure that all the patients who are epileptic are diagnosed well in time and the treatment is started on time, because a delayed treatment means more and more damage to the brain. So once again, I would like to reiterate that epilepsy is eminently treatable, and we should put our best foot forward in the treatment of epilepsy. We should ensure that all the people who have the first episode of seizure, we try to investigate them and to find out a correctable cause for it. And we should also investigate them well in time. It is our responsibility to create social awareness in the society towards epilepsy and towards the myths that it's associated with. We should ensure that people are learned well about it, and because the caregivers are the people who are going to bring the epileptic to the hospital. So it is they whose education is very, very important, and it is they who should realize or who should understand that what they should do when somebody is having an epileptic fit right in front of them. Hence, I conclude by saying that we are all united towards this cause, and we will all fight epilepsy together, and we should not consider it as an enemy. Rather, we should consider it as a close friend of ours and take good care of it and ensure that people are not harmed by it. Thank you very much.